You swing a golf club, hear a pop, and your heart falls, knowing you're going to be down for a few days.
Back pain can be miserable and is the second most common reason someone visits a doctor in our country. Didn't know that. Neurosurgeon Dr. Maxwell Boakye is joining us right now, Chief of Spinal Surgery with UofL Physicians.
Nice to see you.
Terry's going to get tips.
You guys are gods to me because I've had 2 back surgeries and they were both hugely successful. And the only reason I had a second one is because I didn't listen to the doctor the first time who told me to quit running marathons.
Well, let's talk. What are the most common forms, I guess, that we get of back pain?
The most common forms are arthritis, where you have disc bulging, degenerative discs in the back, and they generally would cause a little bit of back pain that may last a day or 2.
And what happens for me and a lot of people I've talked with is you lose feeling down your leg or you get severe pain from sciatica as an indication things are really going awry in your back, correct?
That's correct. When you have back pain, there are a number of things that you want to watch out for. One of them is when the pain is running down the leg. That may indicate that there is a nerve being compressed or nerve being pinched.
So a lot of times I'll get out the heating pad and it goes away in a day. At what point do I know, okay, now I probably need to go see my doctor, I may need surgery? When does it get from a little bit of, putting some heat on it to something more serious?
Generally, when you have back pain, you can try a little bit of rest, maybe 1 or 2 days of rest. You can try the things that you mentioned, the heating pads. If the symptoms persist perhaps maybe more than a week or 2, then it's probably time to call your doc. Another reason to call a doc is, as we mentioned, if the pain is beginning to run down the legs or...
Not normal.
Not normal.
Or you get like a deadening of the foot where I couldn't feel my foot for about a year or so.
That's correct.
Now you brought some props here. Tell us what these are here that you have in your hand.
What is this?
This is an artificial disc. So one of the procedures that's done for back pain is when you take the disc out, you put in a bone graft and you do what is called a fusion. That can restrict the motion of the back. So now there's new technology like the artificial disc that allows you to have back surgery and maintain the normal motion of the back.
Okay.
This one here is what we call minimally invasive spine surgery tube. Used to be most spine surgery was done through what we call an open approach. This allows you to make a small incision about the size of this tube, put this in without disrupting the muscle, and then do the surgery right through the tube.
Boy, that's incredible.
A lot has changed.
Oh, indeed. And obviously for people, when it's a run-up time to consider whether or not to go to surgery, do you ever suggest that maybe they try yoga or any other
exercise
to see if they get some sort of relief before they get surgery?
Yes. In fact, the majority of people that have back pain never end up needing surgery. I would say 98% of people that have back pain will never need surgery. Generally, what we do is if you present with the episode of back pain, that doesn't go away with the bed rest and all that. Your primary care may order a lot of those things, yoga, physical therapy, maybe a little bit of massage here and there for about 6 to 12 weeks.
Wonderful.
If that doesn't improve, then you may get a referral to a neurosurgeon.
Can you write me something for massage, please? Thank you very much.
Thank you so
really
much.
Appreciate it.
Thank you very much.
We appreciate it. Thank you very
much. And University of Louisville Physicians Neurosurgery practice has offices in the downtown medical complex and in eastern Louisville.
You can call 899-3623 or go to UofLPhysicians.com.
Great Day Live on WHAS 11 is sponsored by University of Louisville Physicians.